Great.
Yeah,
Uh,
likewise. Yeah, we're doing well. Thanks for having us.
oh, fantastic. You know,
Yes,
one of
thank
the,
you so much, and thank you for your service as well.
thank you. Thank you. I wanted to start it off with you, Chandra, just to tell us a little about the public affairs officer and then sort of set the stage for talking to Dr. Brunner and also Dr. Stedman.
Okay, so we all know how COVID has sent our world into a tailspin. Everyone has had to quickly adjust to a new norm. So at Jesse Brown, a lot of our appointments were moved to virtual care through telehealth and VA Videos Connect, actually, which we discussed on a previous Cliff Kelly's show. It was back in January, if anybody wants to look it up. But we are slowly starting to move towards face-to-face visits. And Dr. Bruner can tell us all about that. But before I go to him, I actually wanted Dr. Stedman to talk about our emergency department first, which has stayed open throughout COVID 24/7.
Oh,
So
great.
I wanted to start with Dr. Stedman.
Yeah, because I've mentioned that Dr. Stedman is an Army veteran, but he has been the Jesse Brown physician since 2015, right? And has formally taken over the reins of the emergency department in 2019. So it sounds like a fast track, kind of fast moving veteran to me.
Well, I appreciate that. Not certain, but thank you. We all had to sort of dive in head first with
Yeah.
COVID. So
Good.
I don't think it's anything special that we did in the emergency department here. But not only do we run the main ER, but we run fast track,
All right.
and then we also opened the COVID tent outside of the actual building itself to try to pull COVID patients or potential COVID patients out of the medical center to avoid any potential infection of staff or other patients. So we're being kept
excellent.
pretty busy.
Oh, that's fantastic. So you're actually compartmentalizing it. So those people who need emergent care for other conditions other than getting testing for COVID are seen in a different kind of track. That makes a lot of sense.
Exactly. So
Yeah.
we don't have patients potentially infected with COVID sitting in the waiting room mixing with other veterans waiting to be seen for other ailments.
Oh, fantastic. And also, so as you're doing that, it's really that you're returning to normalcy. So explain what that means. So is it that we're still, requiring people to mask? What does returning to normalcy look like?
So yeah, I mean that's a good point. It's actually a new normal,
Okay.
honestly. So the ER is going to continue to run. That actually hasn't changed aside from our big change when COVID arrived. However, everyone in the medical center, both employees and patients, are required to mask up the whole time they're here to prevent any spread. We initially shut down all of the clinics and procedures, and they're starting to open those back up. And so, obviously this doesn't affect the ER because we've been open the whole time, but as we're starting to have more and more clinics open up, we're starting to get more and more patients back, which is nice to see.
Oh, great. So, what do you think, what were some of the things that you would advise our veterans to be on the lookout for if they are looking for emergency room care and or just coming in for COVID testing? Do you think there's certain things that they should be looking out for, as far as symptoms, or how do you think they should view this?
Well, sure. First and foremost, I can't stress enough that we can't assume or act as though COVID is done. We had a big surge here in Chicago, and we made it over the hump, and the numbers have backed off significantly, which is great. However, we need to continue wearing our masks every time we're out. We need to continue social distancing as much as possible. However, also during COVID, we had a significant decrease in our emergency room patient population, and this was seen nationwide. It was a very interesting phenomenon. We would normally see heart attacks and strokes and every other type of emergency, and emergency departments across the country just weren't seeing any of those, and it's somewhat disconcerting that all those patients just disappeared. However, now that, like you said, things are starting to get back to somewhat normal, we're starting to see more of these patients again, and I do encourage them definitely to come to the emergency room if there's any concern about an emergent condition. We're here. We're ready to see you. We've set things in place to minimize risk, and as long as you also minimize your risk as much as possible, wearing your mask, and if not coming to the ER when you're out on your own, just avoiding getting into groups as much as possible. I think we all can safely take care of you.
Yeah, that's a really important point because most of these cases it looks like they're asymptomatic, and if someone has chest pain or they have facial drooping or weakness, and slurred speech and those kinds of things, and different signs of a potential impending stroke, it's better for you to go in because if you do have an underlying health condition and are older now, they can actually be more at risk for the worst complications of the disease, and even including death. So we've been seeing that there is a higher number of people in the category who have died who actually were older than 50 years old, 65 years old. So that is something that I'm glad you were saying that, because they have to realize that those symptoms are real and you need to seek treatment if those things are happening to you. And so when we turn to Dr. Stedman, and I know Dr. Brunner, but I know as the Associate Chief of Staff for Clinical Affairs, you're probably not that busy, right? Especially with COVID-19 going on. So tell us a little bit about yourself and how you fit into the picture.
Right. Well, I'm a member of the senior leadership team at the hospital. I've been there for about 12 years.
Yes.
And as Dr. Stedman mentioned, when the pandemic hit us back in March and going into April, we really shifted our planning. I mean, normally we run about 700,000 visits a year in the clinics, and we have a 200-bed hospital. And like all the other hospitals in the state, we stopped doing elective procedures, and we actually shut down the clinics. And basically, we're only taking care of emergencies and hospital patients. And we prepared for the worst case scenario. Fortunately, that's not what happened. But we did prepare for probably a surge twice as big as what we got, thankfully. Yeah. So we got through that. At the peak, we probably had 25 or 30 COVID positive patients in the hospital each day. Now last week or two, we've been down to 3 or 4. So as Dr. Stedman said, the number of COVID patients that we're seeing has come down, thankfully. But of course, we still all need to be vigilant. Now, during that time, we were very concerned, as Dr. Stedman said, that people that had other issues, heart attacks, strokes, trouble breathing, other chronic illnesses, would be staying home and avoiding the hospital. And, we've been really worried about our veterans that we haven't seen. So the most important thing I want to say today is that it is safe to come into the hospital.
Okay.
If you have an emergency, it's safe to come into the emergency room. If you need to come into the clinic, we have our clinics open. We're only going to be operating at about 25% of our normal face-to-face volume. That's so we can make it easier for us to keep everybody safe.
Okay.
And when people do call for their appointments, we'll give them an option to have it by phone. We have a video connect. But, of course, for some things you do have to come in person. So especially for those veterans that do have serious conditions, we're really anxious to see them if we haven't seen them for a while, and talk to them to make sure they're doing okay. And if they're not doing okay, to get a plan together for what we're going to do about that.
Yes. And, some of the things that, that you just brought into mind, we have, as I mentioned before, we have veterans who span the age range, from young to old. And we actually, one of the things that we are concerned about is this influenza vaccination as well, that we get the yearly flu vaccination so that we can actually get it done a little bit earlier. I'm actually working with the state a bit on that. But, having something done in earlier, like in August, September, in case we do have a second pandemic wave, in the fall that we're not bringing people in and crowding up your emergency rooms with people who have the flu every year. We have about 48,000 deaths a year in the country just due to flu. And so it's something that, I'm not sure of how that's set up as far as people getting their regular routine care, the vaccinations, those things, and what the priority is for you right now.
Well, the priority right now is to, take care of the veterans that have the most urgent needs and, encourage them to call us.
Okay.
If our number is 1-888-569-5282. That's the call center. And you can call that number for whatever your needs are. The flu, we haven't geared up for the flu vaccines yet, but you bring up an important point. We are concerned. Typically in the winter, we always see a bump in volume from flu, and the last thing we want is to have a crisis with flu and a surge of COVID patients at the same time. So we would encourage everybody to come in. We have a vaccination program. Veterans can come in and get their vaccinations at the hospital, and I would encourage them to do that once that's available.
Okay, very good. And what about the video connect? Is there a certain number they have to call for that, or is that the same number you were giving to get sort of connected to that type of service?
Yeah, they can call the same number. What we're doing is we've been reaching out to veterans, and they call. But at the call center, they will run when the veteran calls. Our staff will go over the options with them. So sometimes you can do a phone visit. The video connect is nice because you get a video link, but a lot of things you can do on the phone. And now for other things, if they need a procedure, a test, or a certain kind of examination, they might actually have to come into the hospital. And we've really worked hard along with all the other VAs to set up a protocol, so that we can do that safely. So anyone coming in for a procedure will get tested. And, if it turns out for some reason you're positive, even if you're not symptomatic, we will advise put that off until after you're better, because you don't want to be in the middle of a procedure while you're in the middle of having an infection. So,
right.
So we're the main thing I want to encourage veterans who are on is it is safe to come in, and if you have a problem, please call us or please come in so we can take care of you.
Oh, great.
That's what we're here for.
Yeah, great. I've seen the VA actually dramatically improve over the last couple of decades. I had my training over at the University of Illinois, and you've been doing a wonderful job over there, improving the services. So I'm really proud of what the accomplishments that you've been making. And, one of the other areas is area of psychiatric issues. And the reason why I bring this up is because we're starting to see a lot of, of course, we have veterans who are returning with PTSD, with, psychological, emotional issues, all those. We have people who are homeless. But what about the psychological side of things? Because people are sort of isolated now. And I was thinking about it during the 4th of July with all the fireworks going off in the city, and how that was affecting, our veterans, because we don't have the display of fireworks downtown now. We sort of canceled all of those events. So is there anything you could say about, the psychological outreach to our veterans who, may be feeling kind of isolated right now?
Well, this is a stressful time for everybody. And, of course, if you already, are suffering in one way or another, it can make it worse. So again, I would just encourage people, if they're not in touch, to call. We will see, for mental health, we have a clinic. For people who walk in, we will see them the same day. So you get same day service, and then we will set you up depending on what the needs are with the appropriate clinic. We did continue, and we are providing mental health services adapt well for the telemedicine. So phone visits, video connect,
Yes.
I mean, obviously, the first time we see somebody, we're going to want to see them face to face. But
Right. Right.
once we've met with the person, then there's all those options for follow up. So again, I would just encourage people to not be afraid to come into the hospital or to call us. We've had almost no, knock on wood, hospital acquired infection. So we've been
Yes.
operating very safely. And it's safe to come in, and for anyone
Excellent.
who's suffering
Excellent.
any symptoms, we definitely want to be there for you.
Fantastic. Yeah, and so on the emergency room side of things, and this is for yourself, Dr. Brunner, and for Dr. Stedman, but on the emergency room side of things, so if someone is contemplating suicide, is really depressed, emotionally upset, do we, push, to get people, into that area and make sure that they come through the emergency department?
Yes, I would very much encourage them to come to the emergency department where
Okay.
we're set up to be able to take care of them, and psychiatry is able to come and speak with the person in distress in the ER, so we don't have to shuffle them around.
Okay. Well, okay, we're coming towards the end of the program. I just wanted you to say that number one more time and then give me some last closing thoughts. We have about a minute to go.
Okay. Well, go ahead. Go ahead, Brendan.
So one thing I'd like to point out, so all veterans are aware, Chicago Fire Department does transport to Jesse Brown. There is a specific catchment area, sort of limited to Chicago on the north, 31st on the south, Lake Michigan on the east, and Kedzie on the west. But they will transport from outside that catchment area. The veteran just needs to self-identify as a vet. That's all they need to do. It's not looked into any further. And based on the operational resources of the fire department, they might be able to transport the individual to Jesse Brown. So I think that's a great way for
That's
someone to
excellent.
be able to get here emergently.
That's excellent to know. Yes. I wasn't even aware of that. And the telephone number again, really quick.
I'll give you that. That's 1-888-569-5282. That's our call center. So whether it's a medical issue or a psychological issue or really any kind of even a kind of a social issue for that matter, please call us, and we're here to serve, and we're honored to serve our veterans.
Oh, thank you very much. It's been a pleasure speaking to all three of you. Have a wonderful rest of the weekend, but thank you for standing up for our veterans and doing the work you do.